Who, as you may recall, served as CDC Director during the Ebola and Zika outbreaks. Dr. Frieden, good morning. I want to go back to those projections from the White House, 100,000 to 240,000 dead in just this so-called wave of the virus. So the first question is, how bad is this going to get? And would you advise the White House in the same way that the coronavirus advisors are right at this moment?
Right now, this is heartbreaking. I'm in New York City, where the number of deaths topped 1,000 just in a few weeks. It's a terrible tragedy, and unfortunately, it will get worse before it gets better. But each of us has within us the ability to do a lot to turn the tide on this. There's much more that we can do as individuals to support the healthcare workers on the front lines, and each government needs to do to get ready for what's coming next.
Dr. Frieden, would you be advising the White House now to consider a federal lockdown, keeping people in their homes?
I think we're missing the key point. Having people stay at home is only one part of what's essential, and it is essential. But the other part is to get ready for what comes next. That means getting better eyes on the virus, understanding where it's spreading and how. It means strengthening our healthcare system, not only so that we're ready for the desperately ill patients, but so we can keep caring for people who have everyday health problems and managing those who have mild illness. And most importantly, perhaps, strengthening our public health system, which we've underinvested in for so long, so that we can do the kind of aggressive, proactive, supportive contact tracing, testing, isolation, and quarantine that other countries have used to knock this down. We can do it if we work together.
Dr. Frieden, a lot of Americans listening to you right now are looking for some insight into when their lives may get back to some kind of normalcy. The White House's projections showed the virus descending into the summer. So can we look forward to something in July or August that's almost like normalcy?
It's not like the weather. We can't expect seasons here. We have the future within our power. Look at countries around the world that have been able to tamp this down and then gradually loosen the faucet and get back to a new normal, but not open the floodgates. What does that mean? That means that people who are over the age of 60 or who have underlying medical problems may need to stay home for longer, but we should be able to gradually reopen if we do the right things. It's not about the date, it's about the data. Are we strengthening our healthcare system? Can we proactively find every infected case, every contact, and isolate them promptly? That's what Singapore, Hong Kong, places of China outside of Hubei province where it all started, that's what they're doing, and that's what we can do and must do to reopen as soon and safely as possible.
All right, Dr. Frieden, thank you very much. An important reminder that those projections are not a for sure thing. We have the power to bend them down, and we are working to do so. Thank you again.